Relax your shoulders for me. A little tighter here, okay? Good. Hold on gently. Take a deep breath in. Easy exhale, loose. Perfect. Exhale, let it go. Good. Settle your body. Good. All right, rotate with me. Keep going, keep going, keep going. Good. Good morning, everyone. This is Dr. Warren here at Kalkstein Chiropractic. I'm with Nikki here today. Nikki's no stranger to having these accidents happen this year. It's the second one, unfortunately. But she was in her second bad car accident in April. And unfortunately, your son was in the car with this one. T-boned, you were going through, they had a stop sign. You didn't. It was pretty kind of cut and dry. Side swipe, but relative to the injuries you sustained on this accident, you jammed your hand, you had irritation to the wrist, thumb, into the forearm from the steering wheel. We sent you out for imaging, ultrasound, x-rays to make sure there's no fracture. You had some adhesions and irritation and inflammation to the tendon. Whiplash, neck and shoulder, getting hit like that. I mean, heavy car comes to a complete stop. You take the force of that stop. And so tell me, you've come in here before relative to this, and you work with an awesome attorney, Pinner and Plaka, and they're pretty straight and cut straight to the chase, if you will, of supporting you, making sure that everything's done in like an easy way, because there's a lot of confusion around this type of stuff, especially when it becomes complicated. Yeah. But they do an amazing job with you, so shout out to them. Yeah. But from a clinical standpoint and from a care standpoint, tell me about your experience so far with this injury and with coming into the office.
So from the very beginning, I've always been taken care of with you guys. You guys are very attentive to every single minute issue that I might have that I think is not a big deal. And you guys have really taken care of me, making sure I'm always comfortable, not pushing me too far, making sure that you follow up with me if I miss a day because my kids are sick, and making sure I get back in here to keep treatment flowing nice and smooth. I really enjoy this office and always will come back even for regular maintenance and routine things.
Even if you move to the south, you're going to come back up?
Yes, I will. I'm one of those people.
Yeah, Nikki's amazing. It's so awesome. I appreciate my job relative to this, but I get to know people and their kids and their work and their profession and how they have to balance so many different things. So I appreciate Nikki for a lot of reasons in that sense. And I'm grateful I got to work with your son. Was it Joshua that was good? Yeah. So he was coming in, and it was pretty straightforward. His neck was aggravated. He had a little. He's not really one to be able to describe pain well, but I'm more from a functional standpoint. And me looking at him, and he's like, "Oh, I can't turn my head to the left," and he didn't even realize that, right?
Yeah, he kept telling me he wasn't injured.
But you said, I just want to make sure he's checked out, right? Yeah. And it was a couple sessions in. We adjusted him a few times. Kids respond so quickly to care, and using a functional approach, like looking at him from an assessment standpoint without having to get a ton of feedback, I'm able to kind of dial in on the problem a little bit faster for him. Yeah. And then, like you said, a lot of our patients that are already patients here, if something happens to them, then they reach out to us. We don't do a lot of marketing around personal injury. We don't do a lot of that, if you will, but we just take care of our own. So she just happened to be a patient with us already. But if you're outside of this practice and you've been in an accident, we'd be happy to help you out, start from the beginning. Yeah. But it's nice to have a relationship with the people that you're going to see already. You know how we can help you and dial in on different problems, not just neck and headaches and whiplash, but hey, I know you guys can fix this hand up. Let me get this checked out as well.
Yeah, even with my mom.
Yeah, absolutely.
Because it's not like a chiropractor thing. I wouldn't have said, hey, why don't you try Dr. Warren's office? And she loves this office also, so.
The whole family.
Yeah, the whole family.
Whole family. And about it. It's pretty cool for me. I enjoy that side of things, so it's a win-win. Yeah. And we have an amazing staff. I am not taking the credit relative to her comments. I think about when she says those things at the front desk to the billing and Tanya and to the back of the house where they do the great work that they do. It's not easy kind of having so many different insurances, etc. coming in, but we're in network with a lot of people in order to serve as many people as we can, right? That's literally the approach we can do. As long as it's works, it's a win-win, if you will. Yeah. Right?
I'll pay out of pocket if I have to.
Yeah, there's some people that definitely do that with us, right? There's, that's a side story, but car accident case here with whiplash, shoulder and neck pain, see the whole family, mom to the kids, and then we've had a good results, relatively speaking. We've done a lot of laser light therapy.
I really like that.
Yeah.
Yeah, I like the laser.
It's comfortable. It helps with pain. It helps with supporting tissue that's healing. I like laser therapy class 4 as well. We took it from the Orioles when we were using it with them. The guys use it almost on every kind of ache and pain they have before they go and play. The trainers use it quite a bit. And so we picked it up from working with them in the past. And then same with dry needling. That kind of came in light with what we do with them in the past too. So we're picking up on all the things that the elite athletes are getting. And it works.
Yeah.
So you're going to get to watch while I work on her hand, her neck, her shoulder, see what a treatment looks like. And then you can follow along as she gets a little bit more therapy. Today's her last visit, so I'm going to be doing an exam with her. I'm going to be taking a look at just how she's progressing relative to her neck. So let's get started. You can square up towards me, scoot to the edge just a little bit, and then sit up nice and tall for me. I want to see you turn your head to your right. Now, I am keeping in mind that she had a little spill at the beach. Turn your head to your left for me. So all things considered, there's a little guarding in her shoulders. It might be because she spilled over a huge group of rocks trying to chase after her son in the beach. But we'll take that into account as we're moving her. Good. Bring your chin down to your chest. You do feel just a little tighter through your bilateral trap. Go back all the way for me. So with range of motion, I can check the joints passively by putting compression down on them at the end range. Bring your chin to your chest for me. Very easy. Good. As well as the muscles. And I'm just seeing how she's guarding. If there's any irritation to the joints, just a little bit more guarding through there. I can just feel it pick up already. Right. And then in Nikki's case, she had a lot of shoulder pain as well, and she had some pain referred down her arm. So I'm going to make sure that the muscles, from a myotome standpoint, or that the nerves aren't agitated anymore. So arms like this for me. Good. I'm going to push down. I want you to hold strong for me. You tweak that right shoulder a little bit. Arms like this for me. Hold. Again. Hold. Good. Hold. So creating tension and then muscle strength, and I'm just seeing how it's giving underneath my pressure. And hold. Do this side again. There you go. Good. Wrist back like this, like you're a motorcycle. Good. Each of these correlate with different levels of the neck, right? Relative to the levels that we check, C5, C6, C7, T1. Flip. In whiplash cases, you'll find weakness like this in the beginning due to nerve root irritation or inflammation in the neck from that motion that the neck goes through the car accident. Hold strong. Good. And with conservative care, usually it responds really well. We don't normally need to refer out. We can if we need to for any type of dose packs, epidurals, trigger point injections, things like that. Honestly, just supporting the body as it's going through its healing process is what we need to do. Hands like this. Hold strong for me. Good. Strong. Good. Squeeze your fingers together. Good. Take this. Now I'm going to check your wrist a little bit on that side. That looks good. Good. Relax for me. Good. No numbness and tingling, no sensory changes, so I don't need to do any sensory loss tests in the hand. No upper motor neuron tests. Her reflexes are good after the accident itself. I don't need to check her tricep, brachioradialis, or bicep reflexes that addressed, again, different levels of the cervical spine. She had some positive tests for, it's called de Quervain syndrome, or tenosynovitis of the extensor hallucis brevis and longus muscles in this area. And so I'm going to do a little testing on that. Thumb comes down here and here. I'm just going to load it and see how she's feeling. She could really adduct her first digit before. It felt stuck through the joint and through these tissues. But she's moving a lot better through it. I'm still going to treat it a little bit today relative to some soft tissue work.
Okay.
But from the accident itself, a lot of the things that I saw early on are coming along really well. Reach your arms above your head for me, nice and easy. Shoulder flexion's good. Again, you're a little limited on that right side.
That's the side that took the spill.
Did it? Yeah. Bring your hands above your head. Easy. Good. Good. Okay. And then bring your arm like you're holding a shield in front of you. It's called Hawkins-Kennedy's impingement test. Hold strong for me. It's awesome. Good. Modified empty can. You're going to bring your hand like this. Thumb down. Relax your shoulder for me. Good. Bring your hand up. So So it's a shoulder-focused exam now. Hold strong. Everything else was cervical spine and hand and wrist. Good. Feels good to me. We're going to bring your arm up here. This tests the lower side of the rotator cuffs, infraspinatus and teres minor. Pull your wrist back for me. Hold strong. Good. I'm going to push. Don't let me move you. Come on, come on, come on, come on. There you go. Good. Strong. You let me know if there's any pain with that too, Nikki, okay? So we're going to do a group of cuff challenges here. We're going to look at external rotation in this position. This is going to be more supraspinatus in nature. Hold strong. Good. And then push in, internal rotation, subscapularis. Good. And then again, this is the same thing as a modified empty can, but it's both sides, so I can compare. Relax that right shoulder if you can. There you go. Hold strong. So she's got a little guarding on that right side. I don't need to challenge that side too much or it would hurt. So I know I'm after this is all settled and done, we'll focus on this new injury.
Okay.
Striking them up a little bit.
I know.
That's what happens when you have kids, honestly.
Yeah.
All right, so we looked at the neck, we looked at the range of motion, did passive range of motion, addressed the joints by putting compression on them, okay? We looked at muscle strength, sensory, we didn't need to do, and the upper extremity to, again, look at the neck. Reflexes are good from the start. Range of motion in the shoulders, inflection and abduction is something that I look at. To do abduction out to the side like this, hands go above your head. Good, and come back down for me. Good, really clean actually on both sides. And then we did some specific joint testing, structural testing in the shoulder to see if any of those findings came up. We looked at the wrist. We did a Finkelstein test. Some guy named Finkelstein. Just stresses that compartment. Range of motion in the wrist, palpation, joint palpation as well. And everything feeling pretty good. All right, we're going to do some laser on the hand. I'm going to adjust her mid-back and upper back. And then we're going to release her from care for the accident. Cool. We'll send all your records over. That'll be taken care of. They'll communicate with you, and then they'll do their thing. So however that works. Go ahead and stand up for me. I'm gonna bring the table up, make your life a little easier.
Okay.
There you go. And you can come on in and relax. Good. Awesome. There you go. The kids in camp.
Yeah.
Nice.
Yeah, they had an early morning meeting this morning.
Yeah, my middle is too young to be in camp. My oldest is too young to be in camp. So it's kind of in this in between land of when we can't really drop them off anywhere during the summertime. So
Yeah, mine have to be there at 8 a.m. I'm like, oh.
It's early, yeah. They're longer days. I mean, for sure. But it's nice to give you a little break during the day. Take a deep breath in and relax here. Look forward a little bit for me, Nikki. So a gentle mid-back TL junction adjustment. Good. Good. She's moving really well. Good, loose. Now we combine chiropractic and physical therapy, rehab, fitness within this office. There's more to health than getting adjusted, in my opinion. It's just a catalyst. It's a mover. It takes care of pain really well. Lie on your side, this side up. I get adjusted regularly. I love it. It helps me, especially when I'm all locked up from trying to tube with kids half my age that kill me over the weekend. So it helps me quite a bit, but I reinforce it with movement, stretches, exercises, and we believe in that. We practice it and apply it to our patients too. Come on your side, face this direction. So we have 4 personal trainers out there putting people through some moves, exercises, as well as putting people through just whole body programs. Easy. And relax your shoulders for me. A little tighter here, okay? Good. Okay. Come on your back. Scooch down a little bit towards this way. That's perfect. Good. And relax. Turn your head to your right for me, Nikki. Good. Rest your hand here. Hold on gently. Take a deep breath in. Easy exhale, loose. Perfect. Nice. Good. Now rest. Nikki, I'm actually going to sit you in the chair. You got a little suboccipital tension there.
Okay.
Turn your head to your left. Good. To your right. Good. So, motion palpation in the cervical spine, occiput restricted on the right hand side. This is how I adjust it. Turn your head to your left. Good. Rest your shoulders. Good. I got you. Let your head fall. There's your spot, yeah? Mm-hmm. All right, let your chest fall back. Good. Relax your jaw. Good. Breathe in. Exhale, let it go. Good. Settle your body. Good. Ooh. A little lower and a little easier. You're going to feel most of the movement again on that right hand side. Okay. All right, we'll rotate with me. Keep going, keep going, keep going. Good. Let me see your hand. How's that feel?
Good. I like that one.
Yeah, me too. I asked that. I knew that felt good, to be honest with you. You know what I'm saying? Good. But, people watching, I'm like, what?
No, that felt really good.
Good. Take a deep breath. Easy. Relax your shoulder. Relax your hand. Good. Just easy pin and stretch over the base of that muscle so that I can adjust your hand a little easier. Good. Relax your arm. Good. So she's going to go get light therapy here. Okay. You got time, you can do your stretches. If not, you can do them at home. You know them. We give you picture sheets so that you can just keep doing them at home.
I've been following them from my pictures.
Yeah, nice. It helps. Mm-hmm. Yeah, and I get it. We got places to be. That might be that 10 minutes before we go to bed. That's the only time that we got time to stretch.
Immediately when I get home. Immediately when I go home and the boys are like, "Can I go outside?" Yes, you may.
There you go.
Do my stretches.
Nice. Mine's at 7 o'clock before the shift starts. I grab the foam roller and go out on the exercise floor. Mm-hmm. That's my usual. All right, a little release here. Good. Good. Elbow feels fine. Mm-hmm. You're all set. Cool. Thanks for watching. If you need help about an accident, or if you just want to come get care by us, we have an awesome team here. Come by and see us. Thanks for watching.